ले रही हूँ वो गायब हो गया कैमरा। So good afternoon everyone. Can someone just
Yeah, good afternoon,
check
ma'am.
about
Yes,
this audio
yeah,
quality, like whether you
Ma'am,
are
you are audible.
okay. Okay, thank you everyone. So we are going to start today's session, and today we'll be in this for continuous data, and in this continuous data, because if you can, those of you who have registered with the this categorical data in the last month, so we covered the Cohen's kappa, Fleece kappa, which was for the if you have to perform the agreement analysis for a categorical data. But in this session, we'll discuss the agreement analysis for a continuous data. So we'll be doing these two topics today. The first is the intraclass correlation, and the second is the Bland-Altman analysis. And we'll see how these two analyses are done, seeing their assumptions, how to report this type of analysis, and what model to choose when you have to analyze a agreement between continuous data. So there will be two breakout rooms in today's session. One will be for ICC, and then we'll have a break for 5 minutes. Then we'll go for the second session, which is a Bland-Altman analysis, and there also we'll have one breakout room. So seeing on the total number of participants, you all know about the rules for breakout room. So, but again, we will announce once more, because maybe there are participants who are new and maybe joining us for the first time. For them, we'll announce again. The second thing, we assume that all of you have Jamovi. So install the latest version of Jamovi, which is 2.6.44. Again, I'll show here also, I'll demonstrate. And you need to download two modules. The people who have already done the workshop on agreement analysis, you people have downloaded. That is the Seoul matrix. That's a module. And then other is the Bland-Altman. We'll demonstrate, but these two activities are necessary to perform the analysis in the breakout room. So starting with the intraclass correlation coefficient. So there are two terms in this intraclass correlation. See, if you see this intraclass, there is a term which is the intra, and there is a term which is the correlation. Okay, so I hope all of you are familiar with the correlation, but can someone say what is a correlation? Intra-class I'm leaving for now, but what is a correlation? Because this term, all of you, I know that you know this correlation. And what is this correlation? Yes, and you can type in the chat box, or you can unmute and answer, whatever suits you. So basically correlation is, yes. Yes, Dr. Roy?
Predictable association.
Okay, yes. So basically the term which you have said, the association. And again, Neha has also written the linear relationship between the variable. Very right. So basically in this case, the nature of the variable is continuous. I'm talking about the Pearson's correlation. Yes, there are rank correlations and partial correlations also, but by correlation, the hidden word is the Pearson. So right now we are talking about the Pearson correlation, where the nature of the data is continuous, and we measure the association between the two variables, where the nature of the variable is continuous. That second term is the intra-class. So we'll see how this correlation is different from Pearson correlation, and that's how the invention is. Because if you see classically the history, we have not gone into the detail of the history, but the emergence of these technique, like Bland-Altman or intra-class correlation, that is like a step ahead of correlation. Because previously, before this Bland-Altman, they have, and the I think Fliss, he has made this concept of intraclass. People used to use the correlation only to measure the agreement. And then they saw that that correlation was flawed if you have to measure the association. And that's how the invent of these two methods, like intraclass correlation and Bland-Altman, they came into picture. So coming to the this intraclass correlation, this is basically whenever you have to measure either the consistency or the absolute agreement. Now there are two terms which has been marked in red here. The first term is the consistency, and the second term is absolute agreement between the quantitative measurement, either made by the different observer or made by the different instruments. And we have seen in the last session also on the categorical. The measurement can be done by the instrument, let's say 2 BP machine, or maybe like one, in case of a hemoglobinometer, one standard hemoglobinometer and the other a newer one, or any point of care device with the standard one. So either it can be a two instruments or it can be two people, two randomly chosen people, or one very expert and the other a novice or who is a trainee. So it may be a person or it may be an instrument, but again, the crux is they are measuring the same thing. So that's why here the term is the intra-class, because it is different from the correlation. If you recall your correlation concept, in correlation, what do we do? You have got two variables. They are the two different variables. Let's say correlation between the marks obtained in the class and IQ. So these two are the continuous, but they are two separate variable. Again, correlation between the BMI and let's say obesity, or correlation between the percentage of fat in the body and BMI. Again, they are two separate variable. So Pearson correlation is, now if we know the term this intra and inter, so we will call the Pearson correlation as a interclass correlation. Why inter? Because there are two different variable. But in case of an intra-class, please remember, we are measuring the same variable either by two or more than two. But just for simplicity, I'll be talking about two, but it can be more than two also. So by the two devices or by the two or more number of people. So that's the difference between the correlation and the intra-class correlation. Here also, because it's the same variable we are measuring, so we that's why you will say in literature, it has been mentioned, like maybe people call it as a repeated measure. You can also call it as a replicates. Many times if we have shared the articles with you people, they call it replicates, means the same measurement done by two people or done by the two different instrument or done at two different time points. Because if you can recall, those of you who have attended the scale development workshop or otherwise also, you know about the reliability. So in medical education also we talk about reliability of the question paper, reliability of the assessment methods, and in scale also we talk about the reliability. And there is something known as the temporal reliability. What is a temporal reliability? Like instrument or the measuring this thing is consistent over time. Like if I am measuring something at this point of time, and let's say after 2 months, I'm again measuring. So if the instrument is consistent or the measurement is consistent over time, that is the temporal stability. So this ICC is basically a measurement of reliability. So we are not going to cover, there are different types of reliability. And in last class also we talked about, it's basically the inter-observer or inter-rater reliability. In Cohen's also we have and Fleiss and
ये
Cohen
लास्ट
and
क्लास कौन सी बोल रही है?
last class, Neha, I'm talking about like previous workshop. I'm sorry. Generally, we teach UG students more frequently. So we always refer the last class as the previous class. In this case, probably you are joining for the first time. So last, I'm sorry. I should call it as the last session, means the last month session. And this session is in the continuity of that last month session, which was on the measuring agreement between the categorical variable, and here we are measuring agreement between the continuous variable. Am I making sense to all of you?
Yes.
Okay, thank you, Dr. Alpna. So now we'll go by these two terms. There is a consistency and there is an absolute agreement. So I said that you need to understand what is the difference between these two terms. So in this case, you can see here I have shown the data of 5 patients, and they are the two devices, maybe the blood pressure device A and the device B. And in this case, you can see the difference in the measurement. So what you can see here, yes, can someone type in the chat box? What is the difference between these two devices in the blood pressure measurement? Yes, please type in the chat box. So Manisha is writing device V is constantly measuring the 5 Neha is also writing 5. Manisha is writing B. B means it is constantly reading 5 millimeter of mercury higher than the difference than the device A. Yes, very rightly said. But in this case, if I talk about the now, you have seen this data, okay, device A and device B. If you see the 130 and 35, again 5 millimeter higher, and 150 and 155, again 5 millimeter higher. So if I talk of absolute agreement, so absolute agreement means these two devices are reading exactly the same value. Okay. But in this case, can you call it as a exactly same value? Can you call it? Please answer yes or no. Yes, so all of you, I mean, few of you have written no because it is not exactly reading the same value because there is a difference. There is a systematic difference of 5 millimeter. That means device B is constantly reading 5 millimeter higher than the device A. Similar example we have given here with the rater. So if the rater A gives the score of 80, 85 and 90, and rater B gives a score of 82, 87 and 92. Here also they differ every time by +2. So in this case, if you are measuring the absolute agreement and you are using the ICC, it will lower the ICC. Why? Because here the exact value is not there. Means there is a difference of 2 millimeter. But if I measure the consistency, so what is consistency? Consistency is the relative ranking. Means if I rank the patient, ignoring those differences, are the two instruments giving the same rank? So if you again go back and see this, is the ranking is preserved in case of device A and device B or not? Please answer yes or no. So Manisha is writing yes. And Priyanka is also writing yes. Because you see that here the patient 5 is the highest, having the highest blood pressure, followed by patient 4 and 3, 2 and 1. And similar ranking has been given by the device B. That means if you take the consistency, basically consistency works on ranking. So this focuses on whether the rater keeps the same relative ranking of the subject and it ignores the systematic differences in scoring. So in this case, if you choose the consistency, because we will see in GEMOV, when you perform ICC, it gives you two options, whether you want an absolute agreement or you want a consistency. So depending on your research question, you can select whether you want an absolute agreement or you want a consistency. So if you choose consistency, the same data set will improve the ICC. Why? Because ICC works on the relative ranking, this consistency one. And if you talk about the ICC absolute agreement, it works on exact value. So the choosing the absolute agreement from the ICC option lowers the ICC. If you see such type of data where there is device B is constantly reading 5 millimeter higher than the device A. So am I making myself clear in context of this consistency and absolute agreement? Are you guys getting me? What is consistency and what is absolute agreement? In this, again, I will repeat because
Yes, ma'am.
concepts. So consistency means they are maintaining the same rank order. Like in this case, both the devices are similar because they are maintaining the same device order, like P1 is the lowest and P5 is the highest. But if you talk of absolute agreement, then they don't agree absolutely. Why? Because there is a difference of 5 millimeter, which the device B is constantly reading 5 millimeter higher. Yes. So that's the difference between the absolute agreement and the consistency. So this is again, I will introduce the concept of rank order. Here, in this case, you can see that there are three tables, table A, table B, and table 3. So, sorry, 1, 2, and 3. So in this case, can you identify, like, sorry, can you identify like which in out of these which table there is a consistency between the two examiner? So I'll explain. These are the 5 students. So these are the 5 students, and this is examiner A and this is examiner B. So they have given the marks to the students. And this quite happens, always happens in a viva or in case of a practical examination. If there are two examiners, they give these marks to the students, and these are the rank. So if you focus on table 1, so can you say that they are maintaining the same rank order or it's a different rank? Yes. In case of table 1. So Priyanka is saying yes. Dr. Maria is also saying the yes. So they are maintaining the same order. Now coming to table 2. If you focus on table 2 and see the rank, so this is the rank given by the examiner A and this is the rank given by the examiner B. So are they maintaining the same rank? No, in this case, no, because if you see this 5 and 4, at this here it is 4 and 5. So student 3 has been ranked 5 and student 4 has been ranked 4 where it is reverse in this case. So they are not maintaining the same rank. What about this the third table? Examiner A and examiner B. Is it maintaining the same rank? No. So if you see, in which case it is a perfect rank order? In case of 1. Very right. Near perfect order, near perfect. If I ask this question, near perfect rank order. So it is 2. Near perfect is 2. And no rank order, it is 3. So if I choose the ICC consistency, if I wish to see the this ICC consistency, the ICC value will be high in first case, moderate in the second case, and it will be very low in the third case because it is no rank order has been maintained in case of a third table. Now coming to the so again, if you see these two raters, they have given the different marks. If you see these table, both the examiner here also, if you see, they have given, one person has given 85, the other has given 68. In case of a second student, 95 and 75. Then again 72 and 62. The difference of, there's a difference of marks, but the rank order is, it's the same. So sometimes the two raters or even the two device that may give very different scores to the same set of subject, but still if you see the ranking, they are same. They are almost the same. Okay. In this case, we can see like perfect ranking is maintained because student 1 again rank 2 is given to this student. If you come to student 2, rank 1 is given to student 2. The student 3 rank 4 by both. But if you see the difference of marks, it is high, like 17, 20, 12, 10 and 17. So consistency is maintained. But if you are like talking about absolute agreement, then this is not, it's not perfect. Absolute agreement is not there. Similarly, in this case also, if you see these examiner, then again, this is perfect rank is maintained. If you see this, and this is to given by the both the examiner, the second rank, this one, and then the first and 4 and 5. In both cases, here the rank is preserved. So there is a consistency. What is the difference between the two table? If I talk about the agreement, what is the difference between the two? Yes. Can you see the difference between the marks here? 85 and 68, 95, 75. And can you see the difference here? The marks? This one and this one? 85 and 80, 95 and 92, 72 and 70, 65 and 60. And then there is a difference here. So so yes, what is the difference you can see in both these table? Yes, please type in the chat box. In case of table 1 has a larger difference. Yes, rank are same, but in case of table 1, the difference is large, whereas in case of table 2, difference is very small. Rightly said. Perfect. So if there is an absolute agreement, definitely the consistency will be there. But if there is a consistency, it is not necessary that absolute agreement will be there. Okay. So if I make this statement like while consistency may exist without agreement, agreement is not possible without consistency. Do you agree with this statement? Because if there is a agreement, consistency will be there because agreement talks about, I'm talking about absolute agreement. So if there is an absolute agreement, that means I'm giving nearly same, like two raters are giving nearly same. So in that case, definitely consistency will be maintained. But if there is a consistency, it is not necessary that absolute agreement will be there because we have seen that if there is a systematic shift, means one person is constantly, and you see in case of this assessment also, there's a very strict examiner who is giving very less number of marks, like maybe out of 20, out of 50 he's given like 20, 15, 14, and there's another person who is giving like out of 50 he's giving 40, 35. So if it is a summative assessment, that means the student is pass or fail based on this, then this will have a problem. In that case, you go for absolute agreement because you cannot go for
Ma'am,
consist.
I want to interrupt. Ma'am, I'm not able to understand the previous example which you gave, where the ranking of both the table was same, but the marks were different. So will we call that there's consistency, or will we call it there's absolute agreement?
Okay, in this case, absolute agreement is not there. Why? It is both are consistent actually. Absolute agreement means they should give near same marks. So if you talk like which is near to absolute agreement, so in that case it will be table 2. Why? Because the difference of marks is very less. 95, 92, 72, 70, 65, 60. So this in both the case ranking is preserved. But if you talk about agreement, then 2 is showing more agreement as compared to 1 because we talk relative. So 2 is showing more agreement as compared to 1 because the difference of marks is very huge here. We will, I mean, are you getting this
Ma'am, now I'm
concept?
able to understand. Now I'm able to understand.
Okay. So in case of a research question, it depends. That I'm telling all these concepts because on the basis of these concepts, you will choose a particular ICC because there are different types of ICC. ICC has got like, let's say 6 to 7 types. So based on your research question, you choose a particular type of ICC. And in many articles, you will see that people don't report that, but you should report whatever type of model you are choosing in the ICC. So I was talking about this consistency may exist without agreement,
And may
but
you repeat again what we should repeat?
uh,
What we should report? What we should report?
I'm coming. I'm because I have not talked about the various types of ICC.
Okay.
So I think maybe I made an advanced statement which I should not have made. I'll talk about those types when we will reach to that point. So I'm sorry, Dr. Ashish. Uh,
That's okay.
I'm telling you all these concepts because we are like in a short while we are coming to the different types of ICC which I have not talked till now. So are you people able to understand or am I making sense to all of you up till
Yes,
this?
ma'am. Yes, ma'am. You are making sense.
Okay, thank you. Thank you, everyone. So again, the same repetition of the same concept. Consistency means the two rater follow the same pattern or rank order. Absolute, this agreement means they give nearly, if I talk about absolute, that means exactly same. If I talk about agreement, that means nearly the same value. So if ranks are widely, like very widely different, then there is no consistency and no agreement. But if ranks are identical, then consistency is there. And if both ranks and values are close, then it will be both consistent and there will be agreement. So that's the difference between the absolute agreement and consistency. This absolute agreement checks whether the exact equality of score is there or not, whereas the consistency checks for the relative ranking. And if there is a systematic bias, we have seen that the device B was reading 5 millimeter higher. So if there is a systematic bias, then you should choose the consistency, because then your ICC will be high. So when you should choose absolute agreement. So whenever you are doing measuring something which is very important, like let's say blood pressure, or let's say any point of care device, let's say SpO2, you are measuring the arterial this thing oxygen saturation. Uh, if you are measuring oxygen saturation, and on the basis of that you are going to start treatment or putting the patient on ventilator or start the oxygen supplementation, in that case, if a device is consistent with the ideal one, you will not choose that device. So whenever you need the interchangeable rating, so keyword is your interchangeable. In case of your device where you need the interchangeable, means exactly the same as that of the standard one. Means if you do the ABG and see the saturation, and if you are using the pulse oximeter and see the saturation, so it should be interchangeable. So in that case, you should choose for the absolute agreement in the analysis. But you don't, if when
Ma'am,
you
I'm not able to understand interchangeable. What
interchangeable,
is
interchangeable means, like I was saying you, see, if you can recall, like let's say we are doing right now, I'm just giving you an example which currently we are doing. So there is something known as the lactate meter, through which we measure the pH of a baby, a newborn baby. And that pH of a newborn baby is ideally measured through the arterial ABG. Okay, you know about ABG? We take the
Yes,
sample
ma'am. Yes, ma'am. Yes.
machine and we measure that.
Yes, ma'am.
We have to do this in a periphery. Means in periphery, we are testing this point of care. There is something known as the point of care device. Do you know what this point of care means? It's a
No, ma'am.
small instrument which can be used. And these days, you will know there are a lot of point of care devices. There's an X-ray machine, ultrasound machine. So this point of care device, we are testing it at 5 facility, where we are checking. I mean, in AIMS Patna, what we did, we took the blood sample of all, let's say, 20 newborn babies, and we have the ABG analysis and pH through that. And then we measured the this pH of the blood through this lactate meter, okay, just to see the newborn pH, whether they are suffering from asphyxia or not, because we have to intervene. So then we put this ICC and bland Altman to see whether this point of care device, which is the lactate meter, is it giving not exactly, nearly same value as ABG, or a very different value. Even if this lactate meter is maintaining the rank order, but there is a systematic shift of, let's say, zero point 0.5 pH, will you take this as your point of care device? Now,
No.
answer is expected from you.
No.
Have you understood my situation, like what I'm doing and how I'm
Yes,
testing?
ma'am.
Because
You
if
mean
there
that
is a
if the values come same, then we can say it's interchangeable rating?
yes, so if like my ABG machine on a, so let's say there is a baby where the pH by ABG is showing 7.4 and pH by this lactate meter is showing 7.5 or 7.3. So then I can take it, because it is only by zero point 0.1 it is showing a difference. But if it is showing, let's say, zero point 0.5, and if it is showing constantly a error, sometimes zero point 0.5 up and sometimes zero point 0.5 down, then I will not be able to make a decision whether this baby is asphyxiated or not asphyxiated. So that's why then in such choice, in such cases, if I have to measure the ICC between these two devices, which is the ABG versus the lactate meter, then will I choose consistency or I choose the agreement? What I'll choose in the analysis? Like Priyanka, Manisha, Sarosh, everyone is saying agreement. So that I meant by the interchangeable. So whenever you are doing something where even the small change, and we'll see in the bland Altman where we fix that difference. I'm not talking about that, but interchangeable means like with that point of care device, I should be able to uh, do the activity and will not go for ABG. So that I mean. But again, if I'm doing something, let's say I'm using a PHQ-9 scale, I'm measuring a score of a depressed patient. And even if there is a difference of, let's say, uh, 3 or 4 scores, or if the person is maintaining that no rank order, that he is depressed, or maybe so that absolute or value that does not matter, then in that case you will go for the consistency. For example, I'll again give another example of this case. So, first, have you understood between this absolute agreement and consistency? Am I making sense to all of you? Okay. Now coming to why this matters. So we know now if the devices should be interchangeable, we go for absolute agreement. If it only rank matters, then we go for the consistency. Another example, this we have taken from Norman, and I think we will share that too. We have taken this from a book, and we will share the relevant pages with you people so that you can also go through that. So they have shared these two examples of showing the consistency versus the agreement. So suppose there in a professional school you have invited applications from many person, and there 300 applications came, and you have to rate those applications based on a 100-point scale. So there were three raters, but rater one was very harsh. Like we always talk in terms of examiner also. One examiner is harsh and the other is lenient. So rater one is harsh, but the rater two and three are very lenient. So in this case, if you choose for the absolute score, then you will have less ICC. But if in this case, my objective is to take the top 50 students out of 300 applicants. So in that case, whether this consistency matters or absolute agreement matters. So definitely in this case, rank matters, because they have introduced a term which is known as the norm referenced decision. What is norm reference decision? Norm reference decision means I will take uh, the top 50. Okay. So top 50, then it does not matter where the one examiner is harsh or not harsh, because if he is maintaining the consistency, means he is giving the same rank order, and we have seen a number of examples of these rank order, then this does not matter. In this case, I'll go for a consistency ICC. If it is a licensing exam, suppose MBBS examination, like I was talking, so passing percentage is, let's say, 50%, and one examiner is very harsh. Out of 100, he is maintaining the rank, but he is giving less marks to the students. So will you go, if you are performing such agreement analysis, will you go for a absolute agreement ICC or a consistency ICC? What will be your answer? Agreement, yes, because it's a criterion referenced. If
Well,
the
I'm not still
student,
able to understand this.
okay, so you just tell me what is a passing percentage in community medicine in your institute?
50%.
50%. Okay. So let's say I'm just giving the example with three students. If there are three students and there are two examiners, so one examiner has student one is the top, the best one. The first examiner gave him 70, the other gave him 60, and the third, other means the first examiner gave the 70, 60, and 50 to the one student, and the second examiner gave the 40, 30, and 20. So both the examiner maintained the same rank, isn't it?
Yes,
Means,
ma'am.
but if you have to pass, and if you take the criteria of the second examiner, will all the three students will pass or fail?
Pay.
Fail. So in that case, if you have to measure the agreement, will you choose consistency or agreement?
But ma'am, you said agreement and consistency is different,
They
right?
are not, agreement and consistency are different thing, my dear. You have to decide in the ICC when you will go to the GEMOV. There you have to choose the option whether you want ICC for consistency or you want ICC for agreement. So
ICC
depending
for consistency.
where, in this case,
Yes, ma'am.
why
Ma'am, because the ranking is same.
oh my
Ranking is
dear,
same.
if ranking is same, if you choose the other examiner, if that examiner comes to you, he will fail all your student because he's giving less marks. So if it is a, you will be able to understand more when we'll go to the data probably. Just wait for a few more minutes.
Okay, ma'am.
I don't know about the other participant. Am I vague? I mean, am I making myself clear to all of you, the rest of you probably?
Yes, ma'am. Yes, ma'am.
Okay, so I'll again explain. Criterion referenced means you need at least 50 out of 100. So even if that the second person is maintaining the same rank, thus your student will fail. So you cannot keep such examiner in I mean, generally we don't do these exercises whenever we call, but remember, we take care of these points whenever you are calling someone in your exam. Suppose in during our UG time also there was one examiner who came, who failed, I think out of 100 he failed 40 girls. Okay, so from the next time no one called that examiner again. Why? Because he was very, although he might have maintained the same ranking of the student while failing, but it was a criterion reference decision. That means he need to give at least 50% like marks more than the required, which is there for the passing. So you need in the subjective assessment also, whenever we call some examiner, we always priorly check whether he is expert in failing or he's depending on our intentions, of course. If my intention is like my maximum students, if they are good, they should pass. So if you call someone who is very harsh as an examiner, then there will be more number of students who will be appear for supply examination. Okay. Dr. Beenu is writing for different objective. Yes, that's the main crux of this whole. Like depending on my objective, if I'm doing something as a device or point of care device, I'll choose a agreement. And if I'm going for a norm referenced, which we talked in this case, I may go there. Also, you may choose agreement, but that's not needed because my aim is to go for ranking. Okay, maybe by the end of this, you will be able to understand. If not, I'll again repeat this. Okay. So this is again the systematic bias. You can see here the same we have talked earlier also, like there is a difference of 5 millimeter in this case. Let's say, so we have talked, this is again systematic error. We talked about this consistency. So again, the same thing. ICC for consistency. The research question is like, do A and B rank the patient in same order and we move in the same pattern? In this case, it will be high. Now coming to the models which I was talking, like depending on this, you choose a particular model and depending on how you select your observer or the rater. So Shout and Fleece, they have given this various types of ICC. And you can see ICC, and in the bracket, we have written ICC 11, ICC 21, ICC 31, and ICC, it can be any, it's not 1X, and then this is K. Okay. So I'll explain these various types of ICC. So coming to ICC 11. So there is first one. So what is this first one means? This first one means like the rater are not same for all the people. That means we also, if you go by the Norman, they say that the observer is nested in the subject. And it is also known as the one-way random effect. One-way random means like raters are randomly selected from the large pool and raters are different for all the participants. For example, like let's say this student A, this is rated by teacher 1 and 2, and student B, this is rated by teacher 3 and 4. So no teacher rate both A and B. And this we call as the raters are nested within the subject. Nested within the subject means the raters are unique. The student A is rated by only teacher 1 and 2, and student B is rated by teacher 3 and 4. This is when yours, and this selection of ICC depends on your study design. So, however, whatever study design you have selected, suppose you have, and this happens maybe in case of a poster. We have given you the example also. You present in conferences, okay, and there is a poster presentation. So, poster presentation, you know that let's say there are 140 posters, not all, and if they are being examined by two people, the set of people will be different for each of, I mean, it may be same for few, but it will be a randomly selected raters for from the pool, and they will be rating the participants. Okay. So if your study design is something like that, then you will select the one ICC type 1. Now, what is this another one? So this another one is a form of the ICC second one, where I'm using the reliability of a one rater, single rater score, not the average of all the rater score. So this 1-1 means if ICC 1-1 means if I choose this, that means my study design is like this, that from a pool of rater I have selected randomly, and the raters are unique for all the people and they are nested for that subject. Okay. The second one means that if there are three raters, I'm interested in the rater, I mean the score of one means reliability of one rater. So I will go by 1-1. Coming to this, so what is the takeaway? This ICC 1-1, this ICC 1 is again known as the one-way random effect model. So what is one-way random effect? So it is used when each subject is rated by a different set of raters, which is selected randomly from a large pool. Like 50 patients, each rated by the random radiologist, not the same radiologist. And here we assume that the raters are random and the subjects are fixed. So this is not very commonly done in health. It is not a very common model, 1-1. Now coming to a two-way model. So this two-way model means I will write ICC 2. So this is used when, and this is the most commonly type of ICC model which we use. When there are, like the raters are fixed, but those raters are selected from a random pool. Let's say if in my hospital there are 10 radiologists and I have selected 3 radiologists out of that 10 randomly, but my result will be generalizable to all the 10. So that's why I will go for such type of design, and I will go choose a model which is the ICC two-way random effect model. And this is the most common type of the ICC. Then comes a two-way mixed effect model. So don't go by, I mean, just with model, don't think that this is something very heavy. This is just a terminology and we will make it simple. So what is this two-way mixed effect model? It is also known as the ICC 3. So two-way mixed effect model, when you use the two rater, means it can be two or more than two, but the same raters, they have rated all the people, but they are not selected randomly, means the raters are fixed. So fixed is there in case of ICC2 also. But in ICC2, we have selected the raters from a pool of the rater. We have selected them randomly. So that's why the results are generalizable. But in case of the ICC3, they are the only raters and the result will be generalizable to only those two raters, means it will not be generalizable to rest of the raters. It will be only specific for those two raters. So that's why this is also not very commonly used in health. But the main point is that the statistical value of ICC will be same for the ICC2 and ICC3. The only difference will be the generalizability. In case of ICC2, you can generalize your results to rest of the rater. In case of the ICC3, you cannot generalize because it will be only specific to those two raters. Otherwise, the numerical value of ICC3 will be same as ICC2. So again to repeat, there's ICC1, there's ICC2, and there's ICC3. What is ICC1? If the raters are nested, what do I mean by nested? Means the raters are unique. If the student 1 is rated by examiner 1 and 2, the 2 is rated by 3 and 4. Or I gave you example of poster presentation. When there are 200 posters and the posters are rated by different set of raters. In that case, if I wish to measure the agreement, I will go for one-way random. The second example is if the raters are fixed. That means same raters rated all, but they have selected randomly from a pool of rater. So I can generalize that result to the rest of the raters also. And the third is, it is the fix. The raters are fixed to all the participants, but they are not selected randomly. So the results will be generalizable to only those 2 raters or 3 raters, whatever you have selected. Am I making myself clear to all of you regarding the ICC1, ICC2, and ICC3? ICC1 is one-way random effect. If I again go, ICC1 is one-way random effect model. ICC2 is the two-way random effect model. And ICC3 is two-way mixed effect model. It all depends on your study design. Whatever your study design, the way you have conceived your study, the choice of ICC will be decided. So Hina and Priyanka has said yes. So have you understood now? So Dr. Ashish, have you understood that various types of ICC till now? I don't know whether he's in. That's okay. So
Yes, ma'am. Yes, ma'am.
okay, so Prashant is saying once more summarize. Okay. So now again coming. Can someone, you people can give example of one way. In what case we can go for a one way? So one way is like, let's say, in our case also, whenever we are doing this internal assessment, there's a pre-professional exam. In the pre-professional exam, let's say we are a pool of 9 faculty in our department. So if we all go for examination, and if 2 people are taking exam on 1 person, right? Or if like what we do in this case, we interchange the students. I mean, interchange the faculty, not the students. So if one student is, okay, move slides back. Is it okay now, Shraddha? Okay. So one way is like when your subject is rated by a different set of raters. So maybe if we are 9 faculty, so the students, 2 of us are taking Viva on 10 students, that other 2 is taking on some other student, and thus how we have assessed all the 100 students. Okay. So in that case, the raters are unique for the participants. Okay. In this case, I will choose the one-way random effect because all the 100 students are not assessed by the 2 teachers. They are assessed by the random set of people which are picked from the larger pool. Okay, whosoever is available. So that is the one-way random effect model. Means in this case, what I have written, like 50 patients, they each rated by a random radiologist. They are not the same radiologist, like 1 and 2 for each. That is the one-way random effect.
Ma'am, you mean that like there's 10 patient and randomly we choose 2 raters. So these 2 raters uh, will be different for different number of patients.
Yeah. So let's say there are 20 residents. Okay. In pathology department, there are 20 residents. Okay. So what they are doing, they have made a pool of, like, they have selected all the 2 residents, and like 2 residents have examined 1 slide, and there are 10 slides. So 1 slide is examined by the first 2, the next slide by the 3, 4. So, or means,
Okay,
I'm just for
okay,
example,
yes,
I'm
ma'am.
saying, but the 2 raters are unique for that particular slide.
They will not examine any other slides.
Yes. They will not examine any other slide. So generally, they are means what I mean to say, it's not fixed. They can examine like 2 slides or 3 slides, but it is not like all the slides are examined by 2 people only. Okay.
Okay.
So that is the one way random effect model. When the raters are unique and they are not the same for all. Is it clear to, is it convenient? Who has written this? How to fix the number of raters means? I didn't understand. Is it convenient? Let me see the question. Or sample size needs to be calculated. Sample size we will discuss later. I mean, that's the last part of this session. Sample size of rater, you want to say sample size of participants or rater? Rater. No, rater is again, it depends what is the research question. See, how many raters you will choose. Why did we do ICC? I said that it is for reliability. ICC is a measure of reliability. So depending on the devices, if like I talked about lactate meter, there was 2 devices. If you talk about examination, so you propose a research. It's all about research. So it depends on your research question. How many raters do you want to take? If you want to do all the examination in case of feasibility of your department, if you want to do the ICC of us, let's say even one person can do all the slide examination. So in that case, you can choose a random effect model, that one-way random effect. If any one person will screen that slide, he will screen it in a good way, which will be comparable to everyone. So, as a part of training, if you have gone through those articles, I don't know, we have shared a Bland Altman article where there were seven. Let's say in the training program, for a particular, I am training someone for an assessment of something. Let's say this. On a slide examination, okay? So I am the expert and there are 20 residents under me. But at the end of activity, I just want to check whether they have been trained. Can they replace me if I'm not here? Can anyone replace me if I'm not here? Then what will I do? Tell me. I'll go for absolute agreement for that particular means that slide, if that's a continuous measurement, let's say number of AFB bacilli or whatever. So based on that or any other quantitative measurement, I want that if I am absent, all the residents are equally trained. If I pick anyone, they will be as good as me in doing the slide examination. So if my objective is that, then I will choose 20 raters. All the 20 people, they will be unique for each slide is being examined by 2 random raters. Okay, are you getting it? Ramashish has written, what about the other people? Yes, and that's why I said that it is not very common in health. Because generally, why do we, if you go through all the articles, generally they do for the point of care devices or maybe the temporal stability where the same observer is measuring, giving the response at 2 different time points. So it depends on the research question. So that's the one way. Then the other 2 are very easy. Why? Because the raters are fixed. So if the raters are fixed, whether it is a 2-way or whether it is a 2-way mixed, 2-way random or 2-way mixed, in that case, you will not have any problem. Why? Because it is only the 2 raters who have done all the examination. The problem happens with the first case only, this one. And I think this problem happened with in our prior workshop also, where I was taking the session on fleece kappa. The same concept I introduced, and that time also there was a slight, because that's probably because through repeated reading, this notion is there in our mind that agreement means 2 fixed rater. But that's not the case. I mean, that's less commonly done, definitely, but that's not the case. So the rater could be unique, which is nested. In that case, we use one-way random. If the raters are fixed, that means 2 raters rating all the slides, assessing all the examination, or like in case of a point of care devices, like I was talking, the pH examination by the this arterial blood gas analysis, ABG, and the lactate meter. So the two devices have measured all the value. So in that case, what effect model I will go? I will go for a two-way random effect model. Okay. And then uh, again, not only the two-way, because I have not selected that those are the only two. So I will go with this mixed effect model because those are fixed. I have not selected. So those are those two fixed one. And then comes your, if I have selected those raters are randomly selected from the pool, then I'll go for a two-way. Dr. Shamshad, can you show me that chart? I think someone has written something. Okay, so Farzana has written, okay, I joined late, but just try to understand the types of model in terms of research data. Can we, what she has written, can we? 4DC. 4DC. DC, Farzana, can you explain what is DC?
Yeah, ma'am. Just I want to understand if we have a data of anthropometry and it was collected by four data collector. And in that case, if we want to check the ICC, then which model will be suitable for this?
Okay, so if there are four is fixed, but four are fixed for all, na?
Yeah, but I mean to say like these four data collector will collect anthropometry for different people. I mean, if we have 100 participants, then this 100 will be divided by in this four.
Means all children are being examined by how many raters?
25 by each.
So then how you will see the agreement? Because agreement is seen when you have two raters.
Okay.
So in this case, agreement is not possible. Why? Because there's only one rater. The 100 kids you have divided into a group of 25. And all kids, like one kid is being examined by one person. Nah.
Hmm.
Then there is no question of agreement.
Okay.
Okay, are you getting? Agreement is only possible when there are two raters or two devices, means it should be more than one. Okay, and again, like Dr. Ravi is asking, why generalizability is not there? Generalizability is not there since same set examine in 2 and 3. Why? Because you go with this, na? This question. You want to generalize. Here, I have randomly chosen these raters from a pool. So because the raters are randomly being chosen from a pool, that's why I can generalize this result to the whole pool, Dr. Ravi. But in the third case, there are only two expert radiologists. I have not see, it all depends on my research question. Since I have not talked, you connect your concept of epidemiology with this. So if my aim is not if my aim is not as a generalizability, I don't want to generalize it. So in that case, I will go with this ICC3 because the result will be only fixed to these two expert radiologists. Okay, I have not. They are the only options available to me. So that's why I will not go for ICC2.
Ma'am,
Yes?
ma'am, in case that if you have only got two options
Pardon?
available,
Can you please repeat once more?
so if there are only two radiologists available with you,
Yeah.
then also you will not generalize it. I mean, I have only two radiologists. Then what do I do?
So you go for this method. I said that numerical value will be same, but I cannot say like then I will not go because my research. Then what will be your research question? Your research
No, my
question
query
will
is something
be
else, ma'am. My query
what
is
is the
this,
agreement between these two?
ma'am, how do we take a call as to 3, 4, 5, 6? Say, is it necessary that we have a minimum mandatory 3, or can we take it to 4 or 5 radiologists?
No,
I
no,
mean,
no, no. Are you confusing?
for having, no, no. I am asking the question of generalizability. What is the bare minimum cutoff you have to keep? 3, 4, or 2? That's
No,
my
it's
query.
not. This generalizability is it's not related to the number of raters which you are choosing. It is not related to that. It from a random pool, if you have even if you have selected two, then you can generalize it.
Exactly. Exactly. That's my query. So
Yeah,
even from a random pool, if I have chosen two, I can generalize it, right?
yeah.
So the limiting factor is of randomness of picking of a of raters, right, ma'am?
Yes.
Okay.
Availability of random pool. If random
Understood.
pool is there and you are choosing the rater randomly, then you can generalize it. If you don't
Okay.
have a random pool and you have fixed, then you cannot, whatever study you do, you only, it will be generalizable to those two people or three. Okay. ICC 3. Okay, you have ICC 1. It will be clear more once you go with the, because we have separate activity for this ICC 1, ICC 2 and ICC 3. So it will be more clear. So, but is it clear now? To some extent, I don't know. But I don't know. That's my perception, that there is having some ambiguity. But after all these discussions, are we all on the same page regarding this one way, two way, and two way mixed? Manisha is saying yes. Chalo, ठीक है.
Ma'am, just before to go ahead, just I wanted to clear कि अगर we want to check the pilot data and for example we have a 10 participants, 10 children, and वो now all 10 children will assess by four same data collector, then agreement can is to doing agreement or to checking ICC is possible, right?
Yeah, you can do that because in
Okay.
your study you need to. But again, that yeah. No, there are four people, na? No, one data, no, four data collectors, she is saying.
Yes, ma'am. Four data
Four data
collector.
collector. So all four will take the reading and then you can
Yes.
measure the ICC and then you should do that. Why? Because
Oh,
if you show that agreement is, let's say, 0.9, then one
okay.
person can replace other. Then you can say that inter-observer bias in your anthropometry will not be there. Otherwise,
Okay.
that will be a limiting factor when you write your result. That ideally each children should be assessed by the same person. But because of, if there is no feasibility, like if it will take more time, then in pilot study you can do that as a pilot study and show the ICC between four.
Okay. And which model यहाँ पे अप्लाई होगा मैम?
आप बताओ. चारों ने 10 बच्चों को देखा है
Yes, मैम.
और चारों को तो आपने, I mean, you have not taken these four from a random pool of 10.
हाँ मैम.
These are the only people which are there with you.
हम्म.
अब now you tell me. We have got three options. One तो
हाँ.
हट गया क्योंकि random
हम्म.
नहीं है. One तो हट गया
हम्म.
क्योंकि सब unique नहीं है. So now the choice is between 2 and 3. Now you have to tell me. People
Actually,
are
ma'am,
writing.
I have joined very late,
Oh, I'm
so
sorry. So yes, you can see the answer. They are writing correctly. So it's 3.
okay, ma'am, mixed model वाला.
हाँ, 3 इसलिए अगेन मैंने बोला ना कि 2 और 3 का न्यूमेरिकल वैल्यू सेम आएगा. न्यूमेरिकल वैल्यू अलग नहीं होता है. It will be 0.9. But when you report, you should write that. Why? Because of generalizability, which Dr. Ravi was discussing.
Okay, ma'am. Sure. Thank you, ma'am.
Because they are the 4, but they are the only rater fixed for all the 10 children.
Okay, ma'am.
Now coming to the interpretation. So if it is less than 0.5, it is poor. If it is 0.5 to 0.75, it is moderate. If it is 0.75 to 0.90, it is good. And if it is like more than 0.75, you can say it is good and excellent. So this was regarding the ICC. This one, we have told you this one. So I have discussed this first term, ICC 1, ICC 2, and ICC 3. And then in the comma, there is another 1, and K. Now I will talk about the second part of ICC, that is regarding the rater. This is regarding the rater. How many rater are there and whether they are
Ma'am,
single.
the first part was related to the subjects, right?
First part was related to the number of rater, whether they have randomly chosen unique rater or same rater. And then it's not number, means the how you have chosen the rater and
Okay,
whether they
how
are
we have
same.
chosen the rater.
Now coming to the whether you are using a single measure or an average measure. That means if there are, suppose if there are three radiologists which are rating the tumor size on a scale of 0 to 10. So the rater 1, rater 2 and rater 3, they have given the rating differently. So the mean is 6.3. So are you checking the mean of these raters as a consistency measure, or are you checking the one rater randomly out of this? So single measure means your research question will be, if you randomly pick one rater, how reliable is their score compared to the true score? That is your meaning of your one. If you choose one rater randomly from the three rater, how reliable is their score compared to the true score? And if you choose average measure ICC, then the question will be, if mean of all three rater score, if you use that, how reliable is that mean to the true mean? So whenever you do take an average, your reliability will increase. That means the ICC of the average is more than one single rater. We'll see more in the analysis types also. So that we mean by the second term, which is either 1 or K. Whenever the term K is there, why I have written K means it depends on the number of raters. So it is like, if there are 3, you write 3 here. If there are 2, you write 2 here. So then when you go for a single measure ICC and when you go for an average measure ICC. So it depends again on your research question. So in practice, if I just want to rely on one person or one instrument, then I will go for a single measure ICC. Like for example, I have written a hospital plans to let any one radiologist read that X-ray and make a decision. So I'll go for this single measure. But if I'm doing a research where I want a very specific or precise measurement, then I may ask 3 psychologists independently score depression and I take the average score for the analysis. So in that case, ICC, I will use the average of the 3. So again, Shrout and Fleece, like I said, they have defined these type of model. So if I am writing 1-1, it is like a one-way random and measurement type of agreement is absolute. If I am using ICC 2-1, two-way random, same raters, generalizable. If I'm using 3-1, two-way mixed, same raters, but again they are fixed but not generalizable. And if I'm using like K, that means 2K, that means I'm using the average rating. So whenever this term K comes, this is the average rating. And whenever it is the 1, that means I'm using for a single rater. So that's the different terms which we use for the ICC. There's another example. Suppose I am validating a new tool for a chest X-ray interpretation. So there are 30 X-ray and it has been reviewed by the 2 radiologists. So if the radiologists are fixed and only these 2 radiologists matter, then I will go for this ICC 3-1. If radiologist I have chosen then randomly from a pool, I'll use this 2-1. But if I'm using the average of both score, then I may choose the either 3-2 or 2-2.
You said, ma'am, you said in average we will use K.
K means like I have written K because K represents the number of raters. If the raters are 2, I will write instead of K, I'll write 2. If the raters are 3, I'll take the average of 3, so I'll write 3.
Okay, K means number of raters.
Yeah.
When we are taking average.
Yeah.
Okay, ma'am.
Means average of 2 raters or average of 3 raters. In that case, I will replace this K with a specific number of raters, whatever is there in my study design. Am I making myself clear to all of you up till this point?
Yes, ma'am.
Then I'll go to this concept of between subject and within subject variance, because I have not talked about the variance because this ICC is calculated based on ANOVA. So I need to introduce this concept. So if you are okay up till this point, then I'll go ahead from this. If not, then I'll again, like, how you people have to guide me. Let me see the chat.
Ma'am, am I audible?
Yeah, you are audible.
Ma'am, please, could you please repeat choosing between single measure of ICC and average measure of ICC?
Single measure of ICC and average measure.
Yes, ma'am. Yes, ma'am.
Okay, so in case of a single measure, if I am taking the single measure, that means even if I randomly pick out of 3 radiologists, if I randomly pick one radiologist, how reliable is his rating to the true score? That is one rater. But if I take average, that means if I use the average of 3, how reliable is that as compared to the true score? So it is generally seen that if you take average of the 3 rater, the reliability improves. That means your ICC improves. So again, that depends on the research question. If I'm planning to do something where I think that average is better, then I'll report the average of my raters and show that ICC. If my intention is no, that averaging is not possible, because for averaging you need a large number of raters also. So in daily setting, in hospital setting, it is not possible to use average. Generally, how do we report? In all the lab tests and in everywhere, it is only the single person. So, but in case of that single person, if you want to do a study and if you want to prove that single person reliability is also very good, then you take a single person. You will not take average. So generally, we take single person. Why? Because practically, wherever you are doing the study, it is not always possible to you measure the average. In that case, you can take that. In case of a point of care device, remember, in case of a blood pressure reading and all, if you take the blood, it is always said that take the blood pressure reading thrice, 3, and then take an average of that. Do we say that? Do you agree with that?
Yes, ma'am.
Whenever our students or whenever our field investigator goes in the field, or in case of the blood pressure and diagnosis, we always say that, and WHO also says that take 2 measure or 3 readings. No, at a difference of, let's say, 2 minutes or 3 minutes, and calculate that average. Why we say that? Because in original study, they have proved that the average of 3 BP is, the reliability of that is very near to the original BP. That's why you should take the average. In that case, you don't take 1 BP. Okay. So that's the meaning of like averaging. Whenever you do the average, your reliability increase. That means it will be very near to your normal. That means error will be less. True value, nobody knows true value actually. That's the problem. Morgan, true value is not known. So that's why we are trying to know, because even if you see the blood pressure, we are measuring through this blood machine, that is sphygmomanometer, but that's a proxy measure. We don't know exactly what's the true value. But we are trying to estimate the best possible, which is near the true value. Okay. So Dr. Shamshad is like, it is like truth. So those of you who have attended our qualitative workshop, you know that truth is very difficult to prove, and nobody knows the truth. So there are different realities, multiple realities. So whose reality is real? No one knows that. So truth is difficult to say, but again, you can be very near to the truth. So are you getting about this average and single?
Yes, ma'am. Thank you.
Dr. Jalendra, yeah?
Yes, ma'am. Got it. Thank you.
Thank you. Okay.
Hello.
Yes.
Ma'am,
Ma'am, I have one doubt, ma'am. Ma'am, I'm going to do a people satisfaction and quality of care from
Mm-hmm.
the health and wellness centers. So I'll move on for pilot study, ma'am. So
Mm-hmm.
for that, so I want to do ICC means I choose ICC 2-1 now, ma'am, because the people I chosen for pilot it is around 50,
Mm-hmm.
50 people.
Okay.
Then
So
for measuring ICC, I want what is that model I use? 2-1, ICC 2-1.
no. So you are measuring that quality satisfaction on 50 people only once.
Yes, ma'am. Yes, ma'am.
So then why will you do ICC?
Okay.
ICC, see,
Oh,
ICC is needed when you are doing the multiple observations, means more than one observation. Are you measuring with that tool twice or thrice at a span of some time period, or maybe at a span of few minutes, something like that? Or you are only doing once?
yes, ma'am. Yes, ma'am. I'm doing only once.
So if you are doing once, then how will you measure ICC? I don't know. Then there's no need to measure. What is your research question?
Okay, ma'am. Okay.
Are you getting my point? You need two, you need two raters or two instrument, or if it is the same person, two different time point. If it is not the case, you are not going to do ICC. That is not needed.
Okay.
Okay. Now I think there's another person has written. Someone? Huh? Oh, true value. So all like ambiguity resolved, or still someone who needs something to ask. Otherwise, we will go ahead. Should चलो फिर आगे मैं चलती हूँ. So now concept of you may see the recording also. If it is not clear at this time, maybe when you will do the analysis and when you will again read it, it will become clear. So now coming to the concept of there is a between subject variance and there is a within subject variance, because this ICC is again how this is calculated in the background that we are going to discuss. So suppose this is one example which I have taken from Norman. Here there are 10 patients and they have been observed by three different observers. Observer 1, you can see here, observer 1, observer 2 and observer 3. And I am measuring, I mean, these are what is the outcome? I want to measure the sadness. So there are 10 patients. Observer 1 has given a score of 6 to this patient. Observer 2 has given 7 and observer 3 has given 8. Similarly, you can see the score. There is a difference in the score given by the three observer, and all patients are also different. So if I take a mean of all this, then this is the mean of the all the patients, mean of all the three observer. And this is the mean of all the observer, means mean of observer 1, this 5, this is the 6 is the mean of observer 2, and the 7 is the mean of observer 3. And then this 6 is the grand mean. So now I will show you how to calculate this within subject variance and between subject variance. So please recall your concepts from ANOVA. So what happens here, if I go ahead, so there are three sources of variance or three sources of variability here. One source of variability is the patients. Patients are different. Like patient 1 is different from 2, and you can see the difference in score. Like patient 1 has got 7, then 5, then 2, 4, 5, 9. So there is a variation in patient. So this is known as the patient variability. And then there is a variation in observer also. The mean score of observer is 5, observer 2 is 6, and observer is 3 is 7. So there is a variability of observer also. So, and there is a random error. So three type of error or variability we define in case of a ANOVA also, and here also it is same, because the principle of calculation of ICC is based on ANOVA. So ANOVA here, the what is sum of square? So the sum of square, you know that when you deduct the mean from the individual value, you square it and you add it. That is known as the sum of square. So there are three sum of squares here. There's a sum of square due to patients, there's a sum of square due to observer, and there is a error sum of square. Error sum of square means whatever is left, which was not explained, that was a random error, that is known as the error sum of square. So in case I am explaining this for two-way ANOVA, means two-way ANOVA means the two-way model where the raters are fixed for all and we have chosen it randomly from a pool of rater. So these three type sources error are there. So this is one data set, the same data set which we have put it in Excel, and you can see here for the individual difference or the mean of square, what you do, you deduct the grand mean from the individual mean. So from this mean. So I have deducted this 7 minus 6, 5 minus 6, and I have squared this. So the square value will be like this, 7 minus 6, 1, square of 1 will be 1, 5 minus 6 will be minus 1, square of this will be 1, 2 minus 6 will be minus 4, square will be 16. That's how these data has been arranged. And this total 38 is the sum of square, means total sum of this all data set. Now I will multiply this by how many observer are there? 3. So I'll multiply this by 3. So this will be your total variability or sum of square due to patients. That means patient 1 and patient 2, and all these 10 patients are different from each other, and the total variability or the sum of square due to patient will be 38 multiplied by 3. Same will be with the observer. So I will deduct this grand mean, which is 6, from the 5, from the 6, and from the 7, and then I'll square this. So 1 square 1, 0 square will be 0, and 1 square will be 1. So total variance sum of square is 2 for the observer. So how the total sum of square will be? So it will be 3 multiplied by 38, which is 114. And sum of square due to observer will be 10 multiplied by 2. Why 10? Because there are 10 patients. So 10 patients multiplied by 2, it will be 20. And now the error sum
Ma'am,
of
previous slide, ma'am, can you just show the previous slide? Sum of
Yes.
square for the observer is 10 into 2 because there's 10 patients.
Yeah, ideally it should have been done on each patients, but if you do it on mean also, and that is the way we calculate, because each person has seen total of 10 patients. So their sum of square will be multiplied by 10 to know the sum of square of observer, which is 20.
Okay, ma'am. Thank you, ma'am.
You're welcome. So now comes your the third sum of square, which is the random error. So that error formula, it is difficult. So that's why, although we have calculated this, you can see this. This is based on the observed and expected, the way we do in the chi-square. But it's something different here. So the total calculation, it was 10, which was done in the background. The software does it in the background. So the total sum of square will be your 114 plus 20 plus 10. So total is 144. So what is the formula for ICC? So the formula for ICC, in the numerator, it is the between patient variance, and in denominator, it is the between patient variance plus error variance. So if I have to choose how I will calculate this ICC. So ICC will be what is the between patient variance? So between patient variance is your 114, and then 20 plus 30, both are the error. So this will come in the error variance. Okay. So for example, again, one extension of that, this is the sum of square of the patient, 114, 20, and 10. This is the degree of freedom, and this is the mean square. So how the mean square is calculated? Mean square is calculated if you divide the sum of square by degree of freedom, it gives you the mean square. So mean square is 12.67 for the patients, 10 for the observer, and 0.56 for the error. And how you calculate this error? This error is calculated based on that formula. Yes, it is fixed here, and it is based on that expected and observed formula, which deliberately we are not telling because that's a bit complicated. The software does it in the background, but we just want to make you people understand by this regarding the source of variability. So if you see this, this F value for this patient is 22 and F value for observer is 18. So you can say that the total variability, if I calculate the how we calculate the ICC. So this ICC will be calculated, like I said, the between patient variance means 114 divided by the 114 plus this 20 plus 30. That's how I calculate it. So now coming to the again we will see the interpretation also, how we interpret the ICC. So now again, we introduce the concept of correlation versus ICC. So correlation, we know this is the inter. One is the ICC, the intra-class correlation. In the beginning, we discussed, since it is the same measurement being made by two people or two instrument or the same person at two different time point, that's why we call it as an intra. Now correlation, it is again, if you see the Pearson correlation, here we take two different type of variable. So that means it is generally this Pearson correlation, it looks only at consistency in ranking. It doesn't measure the agreement. And that's why I said that historically this ICC term came. So it requires, if you are calculating ICC, it requires both high correlation and agreement in case of an absolute value. So now coming to the sample size consideration. So how do we calculate sample size for ICC? So this article we have shared a simplified guide to determination of sample size requirement for estimating the value of intraclass correlation. So what are the key inputs of this ICC? So the key inputs are, before I go for the sample size, I think that I missed this. So if I have this value of ICC as 0.904, how I will interpret this? So I will say that I will multiply this by 100 and I will say that 90% of the total variance in score is due to the actual difference between the subject and only 9.7 is due to the measurement error or variability between the raters. So high ICC of 0.9, what does this actually say? This say that this 0.9 is due to the true variability or the actual. That means raters are very highly in agreement with each other that they are able to pick 90% of the variation between the patients. And that's our aim, that one should delineate between these patients. Means the patient who's having low score or a high score. So if larger variability is due to patient, that means my raters are good at picking it. And there is less of inter-rater error and the random error. So that's how I interpret it. Because in the numerator, it is the between patient variance. So if my ICC is 0.903, that means 90% of the variation is due to the between patient variation. And only that whatever is left, that is due to the error variance. So now again, I was talking about the sample size. So sample size, what all do you need a sample size for that? So expected ICC value, how much ICC you expect that it will come. So if you are expecting your ICC, because at least you will have your ICC, it should be more than 0.7. Okay. So repeat what, Alpna? The interpretation of ICC?
Yes, ma'am. Please interpretation.
Okay. So I was telling you, let's say, if the ICC, here it is the value of 0.903. So what I mean by 0.903, that means if you see the formula of ICC, in the numerator, it is the between patient variance. That means the score which I'm seeing is the variance, because I told that ICC basically tells you regarding the variability. It takes the formula of ANOVA into account and it partitioned the variance. So it is telling you if ICC, if it is 0.903, that means it is saying that 90% of the variation in the score is due to the actual difference between the subject. And only the rest of 9.7, you can keep it as 10%, is due to the measurement error or variability between the raters. That means it's a very good, whatever ICC, if it is between raters, you can say that raters are very good at picking these variability, and you can go ahead with any one of the rater, because it's about if if they are the two raters. If it is due to the two device, then also you can say that the 90, because you want to make this error as less as possible. So you can say that error due to the instrument or error due to the random error, that is only 10%. And the 90% it's the between patient variance. So that means it is highly in agreement. So that's how you conclude in case of a
Okay.
ICC. Means the what do I mean by variance? See, why we are doing it, all these things? Because you want to pick, if a person is having, let's say if I'm taking the example of lactate meter, so that should be able to pick the low lactate as well as the high lactate. That should be able to pick the person with a mood with a low score and with a high score. So there is a variability between patients also. So whatever you are seeing, I am so good at picking these variations that if the person comes to me, I can pick a person with a high mood or with a low mood if I am using a particular tool, or if it is, let's say, BPR. If a person is there with a like high blood pressure or low blood pressure, so if the ICC is 0.9 between the two devices, that means it is able to pick the true variability between the patients as accurately as 90%. Means the 90% of the variation which you are seeing it is able to pick the 90% of the variance due to the actual difference in the patients, not due to the error, whether it is due to the observer error, because this is the true variability. This is the signal. We always say this is a signal, and this error variance is the noise. So it is able to reduce the noise and it is able to pick the signal. Am I making myself clear, Alpna?
Yes, ma'am, I understood. Just
So now I'll go to this sample size. So sample size, there is an expected value of R, this this ICC, and generally we say that it should be more than 0.75. So this 0.75 is here, and then there is an acceptable value of R0. So under this, null is generally, you keep null as 0, generally. And then you see the number of raters. You can keep it as 2 or 3 depending on the availability and your research design. The alpha is kept at 0.05 and the beta is 1 minus, like let's say we keep it generally as 80 or 90. So this is the like for a research question, if the research question is like, can a new stress score give consistent result when taken 2 weeks apart? In this case, if my rater, if it is the same person who is measuring, who is giving their score at 2 different time points, that means it is test and retest reliability. And the acceptable reliability under the null hypothesis, I am saying under null that it is 0. And the expected ICC, let's say it is 0.5, but if I want to keep it as 0.7, whatever is your expected ICC, you can write that, power 80% in alpha. Then this is the various table which they have given. So you will use these tables. You can see here, like rater per subject is 2, ICC is 0.5. So observation, this you can see, observation per subject 2, expected ICC 0.5. And if the 80% power, I will keep 22. If I want ICC of 0.8, then I'll keep at 7. So you can see here, as you increase the ICC, the number of subjects decrease. Okay. Similarly, if your initial, another example, if you are already expecting that it is 0.7, and if you want to detect higher agreement, which is 0.9, then again you can use these table, because there you can see they have given many tables, like under your null it is 0.5 and under your alternate it is 0.7, or under your null it is 0.7 and under your alternate it is 0.9. So depending on the how many observation or raters, and the need of your power, whether it is 80 or 90, you can select a respective number of individual from this table. So this is the criteria for the sample size. So I think we are done with the theoretical part. Now I'll demonstrate in the Jamovi. So we have shared the data with you
Ma'am,
people.
I just want to interrupt. I just want to ask one question. In error variance, why do we include SS observer and SS error? Why not only SS error?
Because first tell me why you are doing this ICC. That will answer your question. Why you are measuring agreement?
Ma'am, because to see the consistency between the same measured value.
No, you are measuring agreement because remember you want to interchangeable. You want to change that means if that device should be interchangeable. That's where
Yes,
you are
ma'am.
measuring the agreement.
Agreement.
So you will see the instrument error, na? Here,
Okay.
otherwise, or the observer error. If the two
Okay.
observer, whatever we have talked till now, the examiner giving marks to the students, lactate meter measuring the blood pH. So there will be instrumental error or observer error also. So
Okay.
if you don't consider that, there is no scope how you will measure the agreement, because the measurement of agreement or the ICC takes this that's how we define reliability, that the observer error should be as less as possible, which is a noise you don't want. No, that's why you want
Ma'am, observer error, you mean observer SS, right? Sum
assess.
of square of the.
Yes,
Yes,
of
ma'am.
course.
Yes, ma'am. And then we have a different sum of squares of error. What is that error then?
I said na, that is based on a difficult formula which is
Okay, okay, okay.
calculated for
Okay,
each
okay.
cell
Yes,
using
yes, ma'am.
observed and expected, which is,
Yes,
if I
ma'am.
were to tell you, that will take another half an hour and
It's okay, okay, ma'am.
needed also.
Yes,
See,
ma'am.
by these concepts, we just want to make people realize whenever you interpret something, you should be able to understand what the results are. See, because in software, it is very easy to get whatever you feed. The main important is to take decision. And as a researcher, your role should be to take decision based on your study design and then interpret whatever has come. The rest of the calculation which we have showed, that is only to realize. Otherwise, you don't need to do this. We always emphasize this in every workshop, that you need to take a decision what to put, and then whatever comes, you should be able to interpret. Okay. Am I making myself clear? Should we go to the data?
Yes, ma'am.
Okay, thank you. So now we have shared this data set with you people. So I will start with this 1-1. So this is 1-1 is the poster assessment. I will open this folder and then there is an activity. So this is again the same example which I was giving, assessing the consistency of 3 junior technician. Oh, sorry, this is a poster presentation judging. So we organized a research poster presentation competition in a university symposium. Presenters are evaluated by 2 randomly assigned judges from fixed panel of 4 trained. So 100-point rubric. And now again, I have to give my opinion on clarity, originality, design, scientific content, and delivery. And then these are the various data set. I'll go to the data set. And then I will use 1-1 here. Why I will use 1-1? Because they are ratas are not fixed for all the people, and I have selected them randomly from a pool, and each presenter they are rated by 2 random judges. They are not fixed for all, and I want to see a single measure. I don't want to use a average of this, so that's why I use single measure. So what are my key assumptions? Raters are random sample from a large pool. Each presenter is rated by 2 different judges. They are not the same, and there's no overlap who rates whom. And then we want to generalize. So I have to calculate the ICC. So I'll go to the data set. This is the Jamovie file. I'll open the Jamovie. In Jamovie, like in the beginning, I was saying that you need to open the, download your two modules, the Seoul matrix and the other is the Bland Altman. Bland Altman we can do later also. Downloading. Let me. Sometimes it takes time in opening. Till the time I'll go back to the same thing. Should I open Jamovie first? And oh, now though two files got open. So I was talking about this version 2.6.44. You download, those of you who have now not downloaded, please download 2.6.44. And then I'll show the variable. So double click on the variable. And here I will start seeing. So this is the presenter ID. Then this is the judge 1. There are four, judge 1, 2, 3, 4. This is judge 2. And they have measured on the clarity by judge 1 and clarity by judge 2. Then originality by judge 1 and originality by judge 2 means all the individual concept by two judges, but they are random. They are not the fixed. Again, design, scientific content, and delivery. The 5 components. And then there was a total score of judge 1 and there was a total score of judge 2. That's it. So I'll go to the data set. And for this, I'll go to the analyze. In analyze, download this Seoul matrix. This one. Seoul matrix. How you will download it? There's a plus sign here. Click on this plus. Go to Jamovie library. And just search for that particular module. Type that. So if I type Seoul matrix, it will show and it is writing here installed because in my Jamovie it is installed. That's why it is showing installed. So I will click on this Seoul matrix. There are various options. I will go on this option of rater. So I will click on this rater reliability. In rater reliability, now if I will just first see the total of judge 1 and judge 2. So I will click this judge 1 and judge 2. I will shift these variables here. And then there is an option of here, if you see, ICC of one-way and two-way model. This rater reliability we have seen in the previous workshop. This one. We have seen all this pairwise kappa, fleece kappa. But here I will go for this ICC one-way and two-way model. So if you go for this ICC one-way and two-way model, if you click on this option, see there are two options, one-way and two-way. But can you see that two-way mixed is not here? Yes, why it is not here? Can someone answer this? Why two-way mixed is not here? Raters are different. No? Can someone recall that while I was taking session, I made a statement that the numerical value, yes, Sudhita is perfectly right, that numerical value is same, whether you use ICC 3 or ICC 2. Yes, result numerical value will be same. It is only a methodological issue which you have to choose. whether it is 3 or 2. Are you clear now? What is the ICC 2 and what is ICC 3? Is it clear now? So since the numerical value is same, that's why you will choose here two-way. Now, if in the type, if you see, there are two options, agreement or consistency. So in this case, for poster presentation, do you want agreement or do you want consistency? Why you are judging these posters? Because you want to give prize? And you want to give prize, how do you give prize?
Based on rank.
Yes, rank.
Based on rank.
Yeah. So will you choose agreement or will you choose consistency?
Consistency.
Yes. So I have chosen consistency here. And then coming on unit. Do you want to use do you want to see the agreement of a single rater or average of two? It depends on your research question. Let's say I'm using single rater, that even if my objective is, if there is a high agreement from the next poster session, I will use only single rater. If I have less number of people and I have difficulty in selecting two, I will use only one if there is a high ICC. So I am using a single. And then I will click on this ICC and I will click on this F test for ICC. So if you see, it will write here the ICC, the model, type is consistency, single unit, and there are 20 subjects which are rated by 2 people. The ICC is 0.73. And if you see this gives you 95% confidence interval of ICC, 0.44 to 0.48. But I said that if you take average, ICC improves. So if I duplicate this, no, if instead of single, if I make it average. So right now ICC is 0.73. If you take average, see the ICC becomes 0.84. So it will be more near to true value. Why? Because you are taking the average of two rater. So it will be near to the true value. So many times what you will say people do, just to improve ICC, they take average. But it depends on your research question. Always go by your RQ. If your RQ is on single rater, you take single measure. If your RQ is on average measure, take average measure.
Ma'am, I have a question. Ma'am, I have one question. Like when we see 95% confidence interval of uh, ICC, just on basis of seeing 95% of ICC, how can we make out that a p-value will be significant or non-significant?
Means ICC generally here.
Yes, ma'am. Like in odds ratio of 95% confidence interval, when we say we have 0, then the p-value is non-significant. So likewise, in case of ICC.
See, the null hypothesis of ICC you can see here, it is 0. And the alternate hypothesis is more than 0. Here the 95% confidence interval will not be for 0. Here, if you go to that criteria, I'll show you. Remember, we have seen the criteria for reporting the ICC, where I said that if it is less than 0.75, it is not good. Let me show you that slide. Yes. Moderate. So I will see if one of my confidence interval is less than 0.5, then it is poor. So I will go here. It will be significant because it is more than 0. But if you see 0.61, this is also good, more than 0.5. So even the lower border of ICC, lower interval of ICC is better than this 0.5. This one, poor, better than poor. So I will take it. Again, if I say that no, I want a high ICC. So what I will recommend, that I want average, because with averaging ICC has improved 0.84. So I may choose two raters for the next day also. I will say no. Rating of one rater is having less ICC. So I mean less ICC means what? It is not as near to the true score. So I will use the average of the two judges. Okay. How I interpret this ICC? If it is 0.84, like Alpna was asking, that 84% of the variance it is due to the true variation between the participant. It is not due to either the judge's error, measurement error, or random error. They were really different. That means the person who is at the top, he is really at the top. It is not due to error.
Madam, let's apply one way and see if the results come the same, ma'am.
One way here.
Yeah, let's apply and see if the results come the same.
Okay, sorry. Here the one way. Ideally, it was one way. It was not two way. Sorry.
Yes. Ma'am, let's see one way what results.
Then it is. Sorry, two way. So I think by mistake I did that. Originally it is one way. So it is 0.79. And if you take single data, it will be even less. It is 0.66, very low. Because if you wish to, and if you see the lower border, it is 0.32. It has gone even down less than 0.5. Okay.
Next question.
So this was regarding the ICC one. I will use another data set. Okay. So you can see like this, I took it for the total. You can see domain wise also. Like clarity for judge 1 and 2. Similarly, you can see others also, but don't move all the variables together here. You have to move one by one. So if you see for clarity, the ICC is high here. It is 0.88. And if you wish to like see the other also, I will duplicate the result. Analysis, duplicate. It will be down. Then I will see for originality. And then see the ICC. For originality, the ICC is 0.84. Again, good. Again, you can duplicate and keep on seeing the result like this. So this is for the one. I will now going for the second type of ICC, which is the 2-1. So this is the article which we have shared on physical activity. So this, the author wanted to test the reliability of our adolescent sedentary activity questionnaire, and they have given it to adolescent over 2 weeks time. I think I don't know whether you people have gone through that or not. And then I'll come to this physical activity. This is the exercise which we have shared. So like we are working with a school-based health team evaluating a newly adapted version of our adolescent sedentary activity questionnaire for Indian adolescent. The team wants to ensure that this self-report tool is reliable over time. That is, if students take the questionnaire twice, the responses should be consistent. So we collected the sedentary behavior of the students who completed this questionnaire twice. So one at the baseline and the second 2 weeks apart. And then we want to see the retest reliability of total sedentary time during weekdays using this ICC. So what measurement we have taken? So our objective was to understand what is retest reliability, which is also known as the temporal stability of a scale. With the time, does the response changes or not? This ICC is the ideal way to measure the retest reliability of a continuous measurement. So we have to see the reliability for weekdays and weekends, and then we have to report and interpret the ICC values. So these are the variables. I'll go straight away to the variable. So why we have used the two-way here? Because the people are fixed. That means one person is rating this at two separate time point, and those adolescents has been chosen randomly from a pool of big this thing. So that's why it is two-way. So two-way. And the type here, I am measuring the absolute agreement, and unit I am using the single. So now This is I have written why we have selected the two-way, because we
Ma'am,
are
it's up
measuring.
to us when we will choose single or average, right? It's up to
Yeah,
us.
yeah,
Okay,
yeah.
ma'am.
So we are measuring the same participants and two different time points, baseline and week 2, and using the same tool each time. And then the students, the question is, do the students give the same value across time? Is the questionnaire stable? Which is the two-way, stable means temporal stability. So are the raters or method, in this case, the raters are two different time points, baseline and week 2. So I'll go to this type here. We want to check the absolute agreement, because we don't want any, I mean, my aim is to not see the consistency rather than because for temporal stability, I will be needing the absolute agreement. So that's why, because does this value exactly matches or nearly between time 1 and time 2? That's why I'll check for the absolute agreement. And then I'll go to the data set. So this is the data set for the physical activity. So if I go to the variable, this is the grade of students. In the article also, they have taken the grade 6th, 8th and 10th grade students. And this is the gender of students, age. This is the weekdays. They have, if you see the questionnaire, there are various sedentary activities while reading. So education while going through their routine education, what is the activity in the baseline and at the end line? Then what are the social activities at the baseline and at the end line? So this is the weekdays social activity as baseline, then weekdays social activity at end line. So what is baseline and end line? There's a difference of 2 weeks between the baseline and end line. Similarly, there is a travel activity between baseline and end line. Then again, there is a total. So if you add it, all these activities, there is weekdays total baseline and weekdays total end line. And the same variable is there for a weekend also. So there is a weekdays and weekend. You can go through the article and you can see the questionnaire. The author has given the questionnaire also. So that way you will be able to appreciate more. So now I will go to this Seoul matrix and go to this rater reliability. I'm showing with the total score. So I will use this weekdays total baseline and weekdays total end line. That means total score between, at a gap of 2 weeks, what is the agreement. So I will use two-way in this case, and I will use agreement because that's the exercise. It depends, if you want consistency, you can give. But if the author is desirous of agreement, he will write agreement. And then here you may write single, because again, you wish to see, either you can take single or average depending, but generally you take single. Why? You want to see the temporal stability. There you are not going to take the average of 2. If it shows the average of 2, then again in the future also you will have to use the average.
Ma'am, I
So
just want to ask one thing. Uh, in rater reliability option, uh, like if we click on rater reliability, then there is inter-rater reliability and intra-class correlation coefficient. So should we click on both or only on intra-class correlation coefficient?
no, we don't use this because this is in general, it is not specific here. That's why
Okay,
better to use this one-way and two-way models, because
okay,
it depends on the study design also.
okay.
Because that doesn't give you the means, it's better if you see the literature and the types which they have defined. Uh, you should use this one-way and two-way. But again, if you have asked, I'll check with that also. So 0.71, if you use this two-way agreement and single, agreement is 0.71 with the confidence interval. You can see the confidence interval is even it is in the minus here. So you can say that's why P is, it is not very significant here. And the value of this F value is 15.23. So now if you are saying this, if I go with this example of ICC and confidence interval, You can see here. Yeah, actually here in the confidence interval, it is using a formula of bootstrap and it will run this 1,000 times. So many times it buffers and takes long to give you the result. But we'll see. Here it gives you like rater, this thing also. Subject variance, rater variance, residual variance, consistency. Okay, in this case also it gives, but this takes into account like I'm not sure which model it is using. If you don't wish to specify the model, you can simply go with ICC this. But if you wish to specify, generally the way ICC has been defined, you should specify it. If you go by the standard textbook, they specifically ask for these specific models. But again, the most common is the two-way. If they have not mentioned anything, that means they have done the two-way, means 2-1. Again, it will take time. So you can just check if, because the value of ICC they have given 0.71. So value is same if you see. Can you see, Ashish? The rest of
Yes,
the
ma'am.
taking time.
Yes, ma'am. Even
But
in my software, it's taking time. It's not showing the results yet.
again, I said that because of saying this bootstrap thing. Because it will
Okay.
run those many times in the background, that 1,000 bootstrap, take out the data, and that's why it will buffer, and it takes time.
And in my laptop, the version is of not 0.44, maybe because of that too.
No, now it has stabilized. See, it has given you 0.68 to this. But again, the bootstrap confidence interval will be different from the
Yes.
confidence interval which
Yes,
you
ma'am. But in my laptop, I'm getting ICC as 0.793.
with the same
I
data
don't
set.
know. Yes, ma'am, in the same data set, ma'am. I don't know why.
With
I
these options also, agreement and single.
Oh, yes, sorry, ma'am. Yes, ma'am. Sorry. I kept
You
two.
seen that?
Sorry.
Because here it is giving you both. The for consistency it is 0.81 and for this thing it is 0.7. Okay. But it doesn't give you what it gives for consistency or agreement. So now I will go for another data set. I will close this. And I will go for another data, which is your 3-1. So 3-1 is again, if you read the exercise, it is again evaluating consistency between a junior and a senior technician in blood glucose measurement using 3-1. So like you work in a diagnostic lab, a junior technician has completed 3 months of training under a senior technician for measuring blood glucose level using a standard glucometer. Before allowing the junior technician to independently take the charge of glucose testing, the administration wants to check is the junior technician consistent or the in agreement with the senior technician in measuring blood glucose levels. So I have to check whether, so on 20 patients, I will ask both these two raters to measure the blood glucose using glucometer. And since they are fixed, means I am not generalizing it to any other staff, I will use ICC 3-1. But again, I said the numerical value will be same. So this is just the other description. I'm not going into the detail. You can read that. I will open the data set. And then we can see this is the 20 people. I will go to this Seoul matrix, rated reliability. I will use these two. Use the two-way. And depends if you wish to measure agreement. But again, here unit I will use single because my research question is like whether this junior technician will be able to measure. So I wish to use only this. So then you can see this. This will give you two-way and the ICC is 0.93 with a confidence interval of 0.65 to 0.98. So this is highly in agreement with the senior technician.
Yes. Ma'am, one more thing I wanted to raise. I'm trying to open this OMV file. It's not opening up. It says it doesn't exist. I don't know whether everyone is facing the same problem like me, or is it only me?
Okay, so what you can do, I'll show you. First, go to your this window. Type GEMOV.
Yes, ma'am.
Means or from your desktop. First, open GEMOV and then you open that file. Don't
Okay,
directly open that file. First,
Okay,
open
okay.
the software, the
Yes,
GEMOV,
ma'am, I got
then
it.
open the file. So if it is okay up till this point, we can go to the breakout room. Let me see how many. हाँ, हो गया ये तो. So you can practice. I think we can give for mentors. How many mentors are there? If not, then we will keep on moving to the each breakout room.
Just they have to practice.
So all of you, please open your data set. How many breakout rooms? There are 40, 35. So we are making 7 breakout room. And in that breakout room, please identify one leader or one person who will look after the activities that everyone is sharing the screen and participating. But then p-value, you interpret the confidence interval. Because p-value doesn't make sense here, much sense. So I'll again go to the data set. We'll open this 3-1, na? 3-1 is like they are the fixed raters, means they are not being chosen randomly from the pool. Again, 3-1 is 3K means 3 is for the two-way mixed model. And why we write it 3? Because you see that in case of here in mixed model, we assume that they are the only two raters. So if you see the question, the senior technician, if I open the question once again, so I have to evaluate the consistency between a junior and a senior technician in blood glucose measurement using 3-1. Means I am using the single person, one person value. Whether if I pick one random person, how close that value will be to the true value. That's why my aim is. If you write 3K here, that means instead of 1, I am using the average of 2 people. In this specific case, since there are 2 raters here, one junior technician and one senior technician. So here it is only 2 people are here. That's why it is 3-1. And I'm interested in single person's reading. If I pick random person, how will that close be to the true people? That's why I'm using 3-1. Is that okay, Dr. Ashok? This 3-1?
I would like to understand the problem of 3K that is given in your data set.
Okay, the other data set. Okay. So there was another data set of 3. Okay, this you are asking. I'm sorry. So if you see the question, here it's not 1, but there are 3 raters. So there is a clinical lab where 3 newly trained junior technicians, they have joined as a part of maybe training program. And as part of their competency evaluation, each technician independently measure blood glucose level for the common set of patients. So here, if you see, the 3 people are fixed for all the raters, and the same set of patients were tested by all 3 technicians. So that's why it will be a 3-way. Why? Because they are the 3 newly trained and newly joined, and I have not picked them up from a pool of the technicians. So I will use 3. And why K? Because I want to see, my question is, how consistent are the average scores of 3 junior residents or the 3 junior technicians, not residents, across the patient. If my question is this, then definitely I'll use 3K. If my question is, how if I randomly pick one technician out of 3, how what is the ICC, means how much he is close to the true score? Then in that case, I will use 3, 1. But if I go to the data set, I'll open the data set. And it is a set of 20 people. I'll go to this Seoul matrix, rater reliability. I will use all these 4. 3 plus this senior technician, because I just want to see the average of these 3 as compared to the this one, all 4 in fact. So I will go with this 2-way because they are fixed. That's why I'll go with the 3-way. And then agreement. If you want to check consistency, you can, but let's say agreement, and then average, K. And then I'll check all these. So this is a 2-way agreement, average 0.91. And regarding the confidence interval, if you see, the lower is 0.78. And if you have set like, at least it should be 0.75. Like we said that if you consider that it is good, more than 0.75 is good. So even the lower border of confidence interval is above that 0.75. So I can say that even the confidence interval is good in case of this ICC. So rather than p-value, because p-value it will be significant only, because there will always be some value of ICC. If you see this ICC 0, then also there will be some value, so p-value will be significant. If it is alternate hypothesis, if it is more than 0. But confidence interval has more value in case of ICC to report. So how you report? And these days also you see that generally we report confidence interval, not the p-value. So this is like 0.78. So you can say even the lower border of this confidence interval, it is more than 0.75. That means it is having a good agreement, the average. And if you take like individual, that means if I randomly pick one person from this pool out of 4, then they have a ICC of 0.71. And in this case, even this lower is even falling with less than 0.5. That means this ICC is not good. That means I will say that no, I have to use the average score. If I use the single score, then the ICC, the confidence of interval of ICC of 0.47, it goes less than 0.5, which falls into a bad agreement or not so good agreement. Have you understood, Dr. Ashok, and who has asked about this?
So we have to take average every time. We cannot take a single agreement in this
No,
case.
you don't have to take average. You may report it. Like you may say to the administration that the single is showing only a reliability of 0.71. That you can report it actually.
But we cannot say that junior tech 1 is good or 2 is good or 3 is good.
No, we cannot. Based on this ICC,
Yes.
you can take fair. If you see the value of 0.71, it comes into the fair one. But again, if you take confidence interval, it is 0.47. It is less. So they need more training. In that case, what will you do? You will train them more for again 1 month, and then again repeat the same exercise.
Ma'am, can we take 2 of them, I mean, any one, like senior technician with any one of them, and see that whether 2 of them are doing, having a better score, and we
Yeah.
can judge them like that.
You can do. So you can do 1 by 1 also. I can take tech 1 and the senior tech. And then if I take this agreement and single, and then see ICC is 0.93, this is good. If I take, instead of this junior, I will take this tech 2 and then see. So this will show, this is 0.63. So this way you can point out, like this tech 2 is giving you the problem because ICC is 0.63. Again, if I see tech 3, So Tech 3 again you can see it is 0.62. So you can say that Tech 1 was okay, he's good. But Tech 2 and Tech 3 they need training. So you can do this way also. Like you can do pairwise or you can do all together. It depends. And this is like one step ahead. After you have seen that agreement was not so good, you can compare like with senior person because you consider that he will be reading good. I mean, he's experienced one. And then point out like who needs more training. So in this case, Tech 2 and Tech 3, you will train them for more number of months and then again repeat the exercise. Is it okay?
Yeah.
Okay. So understood all the concepts of 3-1, 2-1 and 1-1 now and K. So we'll go to the